The Heal Your Mind Anxiety Program, an online support program. Part 1, Understanding Anxiety. Anxiety is the body's normal response to stress, but it can become an issue when it hinders your daily activities. It's an issue when you feel sudden panic, when there's no real threat, or feel overwhelmed for non-threatening activities, such as being in an elevator or interacting with a stranger. Globally, an estimated 284 million people experienced an anxiety disorder in 2017, making it the most prevalent mental health. Around 63%, 179 million, were female, relative to 105 million males. Worldwide statistics. Anxiety disorders were the most common in all countries studied, except in one country. The World Health Organization, WHO, 2020 survey looked at anxiety disorders, mood disorders, impulse control disorders, and substance disorders, as shown in the diagram. What is anxiety? The experience of anxiety is necessary and very normal. In fact, appropriate levels of anxiety will increase alertness and performance when needed, such as participating in a job interview or sitting an exam or competing in a sports event. Even higher level of anxiety is necessary to increase arousal and reflexes when faced with a situation where real danger is present. However, when unwarranted, persistent, and severe anxiety is experienced, it can be debilitating in that it can affect your ability to process new information, plan and problem solve, and to perform complex tasks. When you suffer from an anxiety disorder, you have specific and reoccurring fears that you recognize as being irrational, unrealistic, and intrusive. There are different types of anxiety disorders, including panic disorder, agoraphobia, social phobia, specific phobia, generalized anxiety disorder, obsessive compulsive disorder, adjustment disorder, post-traumatic stress disorder, and acute stress disorder. Generalized anxiety disorder and panic disorder are the most common of all the anxiety disorders. Generalized anxiety disorder, GAD, is characterized by persistent, generalized, and excessive feelings of anxiety, which occur without any particular environmental circumstances, and caused by general tendency to worry excessively. Typical worries include exaggerated and excessive concerns about the possibility of a negative situation occurring, such as a family member becoming ill or having an accident, performing poorly at work or socially. The symptoms will affect you in that you may have a problem with making daily decisions and remembering commitments as a result of the lack of concentration and preoccupation with worry. Do you experience compulsions or obsessions? Then consider obsessive compulsive disorder, OCD. Does a highly stressful event cause anxiety that's re-experienced with arousal and avoidance of associated stimuli? Then consider post-traumatic stress disorder, PTSD. Does a stressful event, it needn't be extreme, cause anxiety but not re-experienced with arousal or avoidance of associated stimuli? Then consider adjustment disorder with anxiety. Does chronic worry with multiple problems lead to restlessness, fatigue, irritability, tension, and insomnia? Then consider generalized anxiety disorder, GAD. Do you have a fear of being away from home or where escape is difficult? Do you have a recurring surprise panic attacks with resulting concern? Then consider panic disorder with agoraphobia. This checklist is designed to help you reflect on your situation and not to provide a diagnosis. For that, it's recommended you see a doctor who will be able to tell you if you have symptoms in common with people who suffer from GAD. You must have been bothered by these common symptoms of generalized anxiety disorder on most days for a period of at least several weeks, but usually for a period of 6 months. Nervousness or restlessness, trembling, trouble falling or staying asleep, sweating, poor concentration, palpitations, frequent urination, muscular tension, easily fatigued, irritable mood, lightheadedness or dizziness, hypervigilance, shortness of breath, and depressed mood. Unlike in generalized disorder, where the symptoms of anxiety are usually expressed for the most part of the day on most days, in panic disorder, a person suffers from brief attacks of intense fear and apprehension, often characterized by trembling and shaking and confusion, dizziness, nausea, and difficulty breathing. These panic attacks, or anxiety attacks, as they're also known, are described as fear and discomfort that abruptly arise and peak in less than 10 minutes and can last several hours and can be triggered by stress, fear, or even exercise. The symptoms of a panic attack most commonly experienced, but not limited to, include shortness of breath, dizziness or lightheadedness, tightness or pain in the chest, faintness, trembling or shaking, feeling of unreality, dry mouth, muscular tension, difficulty gathering thoughts or speaking, pounding heart, tingling fingers or feet, a choking or smothering feeling, sweating, hot or cold flushes, urge to flee, nausea or butterflies, blurred vision, fear of dying, losing control, or going crazy, fear and apprehension, trembling or shaking, restlessness, cold and clammy hands. Other less common symptoms include headaches, back, neck, and shoulder pain, tightness in the throat. For a diagnosis of panic disorder, the said attacks must have A. chronic consequences, either worry over attacks' potential implications, being socially humiliated, losing control, going crazy, or related to physical health, B. persistent fear of future attacks, or C. significant changes in behavior related to the attacks. In other words, panicking about having a panic attack. Often symptoms can be so frightening that even the fear of having a panic attack can actually be a trigger to experiencing a panic attack. Some of the symptoms of a panic attack can resemble that of a heart attack, for example. Chest pain or tightness in the chest, tingling, nausea, and difficulty breathing. The following checklist may be helpful in distinguishing between symptoms of panic and symptoms of a heart attack. Note that this checklist is a guide only. It's recommended you seek out medical advice from your doctor for a thorough medical assessment and accurate diagnosis. If heart disease is not present following a medical assessment by your doctor, they should be able to tell you whether a subsequent chest pain is a result of anxiety or some other condition that might need further investigation. Distinguishing a panic attack from a heart attack. The symptom of pain in a heart attack may or may not be present. If it's present, the pain is often described as a crushing feeling, like someone standing on the chest. The pain is usually located in the center of the chest and may spread to the left arm, neck, and back. Pain is not usually made worse by breathing or pressing on the chest. Pain is usually persisting and lasts longer than 5 to 10 minutes. In a panic attack, any pain is usually described as sharp. The pain tends to be localized over the heart. Pain is usually made worse by breathing in and out or by pressing on the center of the chest. pain usually disappears within 5 to 10 minutes. The symptom of tingling is usually in the left arm in a heart attack, whereas in a panic attack, tingling is usually present all over the body. The symptom of vomiting, that's quite common in a heart attack, whereas nausea may be present, but vomiting is less common with a panic attack. Breathing. A heart attack does not cause you to hyperventilate. Panic does. With a heart attack, you may feel a little short of breath. It is possible, however, to have a heart attack and then start to panic. In this case, hyperventilation is a symptom of panic and not of heart attack. Hyperventilation is an extremely common pain response which precedes most panic attacks. The nature of normal anxiety. Diagram realistic fear-stress response. Anxiety is a normal and healthy necessary response to deal with threat or danger very quickly. To understand anxiety, you need to first understand the normal stress response, known as the fight or flight response. When you experience a life-threatening situation, such as being involved in a serious motor vehicle accident, being chased by a vicious dog, or being physically assaulted by someone, physically, mentally, and behavioral changes occur within your body. These changes are caused by hormones that are released by the brain. Once your brain becomes aware of the danger and hormones are released, the involuntary nervous system sends signals to various parts of your body and prepare you for the fight or flight response. The fight-flight response is an inbuilt coping mechanism that every human and animal has in order to survive. It is designed to help us flee or fight in a real threat. When experiencing a stressful event, the amygdala, an area of the brain that contributes to emotional processing, sends a distress signal to the hypothalamus. The autonomic nervous system has two components, the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system functions like a gas pedal in a car. It triggers the fight or flight response, providing the body with a burst of energy so it can respond to a perceived danger. The parasympathetic nervous system acts like a brake. It promotes the rest and digest response that calms the body down after the danger has passed. After the amygdala sends a distress signal, the hypothalamus activates the sympathetic nervous system by sending signals through the autonomic nerves to the adrenal gland. These glands respond by pumping the hormones epinephrine, also known as adrenaline, into the bloodstream. Adrenaline leads to arousal of the sympathetic nervous system and reduces activity in the parasympathetic nervous system. As adrenaline circulates through the body, it brings a number of physiological changes. The heart beats faster than normal, pushing blood through the muscles, heart, and other vital organs. Pulse rate and blood pressure go up, breathing becomes more rapid, small airways in the lungs open wide. This way, the lungs can take in as much oxygen as possible with each breath. Extra oxygen is sent to the brain, increasing alertness. Sight and hearing and other senses become sharper. Blood sugar, glucose, and fats from the temporary storage sites of the body are released to supply energy to all parts of the body. The following normal changes to the body occur in response to these hormones, in particular, adrenaline. Normal physical changes associated with the fight or flight responses. The mind becomes alert. Blood clotting ability increases, preparing for possible injury. Heart rate speeds up, blood pressure rises. Sweating increases to cool the body. Blood is diverted to the muscles, which tense, ready for action. Digestion slows down. Saliva production decreases, causing a dry mouth. Breathing rates speed up. Liver releases sugar to provide quick energy. immune responses decrease. All of these changes that occur during the fight-flight response is designed to optimize your chances of surviving. When your adrenaline gland dumps the stress hormones cortisol and adrenaline into the bloodstream to create an adrenaline rush, your body is activating a heightened state of physical and mental alertness. During your life-threatening situation, if the amount of adrenaline that is released throughout your body is warranted, then the more alert, stronger, faster, efficient, and effective you'll be, the higher chances of you surviving. The wiring is so efficient that the amygdala and hypothalamus start this cascade even before the brain's visual centers have had a chance to fully process what's happening. That's why people are able to jump out of the path of an oncoming car before they even think about what they're doing. Once the threat is over, the parasympathetic branches take control. Hormone levels return to normal, cortisol and adrenaline levels drop, heart rate and blood pressure returns to baseline levels, and the body resumes its regular activity. As long as it's not long-lasting, that burst of turbo fuel can be a good thing. So what happens when cortisol is released regularly due to a chronic stress or significant stressor being present for a lengthy amount of time? The cause of abnormal anxiety. When the adrenaline released in your body is the right amount, then you should experience normal and healthy anxiety in response to a threatening situation present. To experience normal anxiety, the amount of adrenaline released in your body will need to be utilized in the flight or fight response. An excess of adrenaline is unused. It will simply sit in your system. So, for example, you needed 100% of adrenaline released to tackle a threatening situation. Your body released 100% of adrenaline. Then you wouldn't have any extra adrenaline floating around in your body. It would just be the right amount of adrenaline needed to deal with the situation, and you would therefore experience normal anxiety. But if your body releases 100% of adrenaline and you only needed 50% of the amount of adrenaline to deal with the situation, then you would have an excess of 50% released into your system, not being used. This excess would generate the symptoms commonly experienced during an anxiety attack.